This is my audience. Okay, make sure it's getting my football. Good evening, everyone. My name is Cheyenne Davis, and I want to talk about the vital role of nurses in healthcare. Often referred to as the backbone of healthcare, nurses play a large part in patient care and the overall functioning of the healthcare system. Their contributions are not only critical for patient outcomes, but also for the emotional and physiological well-being of those who they care for. What is a nurse? At its core, nursing is a profession dedicated to the care of individuals, families, and communities to maintain or recover optimal health and quality of life. Nurses are trained professionals who combine scientific knowledge and compassionate care to support patients during some of the most vulnerable times. To become a nurse, there's a couple different ways. The first one, you can become an LPN, and you can get that at a trade school. It's usually like a year-long program. The next is like an associate degree program. That's two years, and you get that at community college. Next is the Bachelor of Science. That's a 4-year program. And after any of the programs, you have to sit for board, which is called NCLEX, to obtain your official nursing license. Continuing education is the critical aspect of nursing. Many states require nurses to complete a certain number of continuing education hours to maintain their licensure. Nurses have a diverse range of responsibilities that can vary widely depending on their specialization and work environment. Here are a couple key roles. Direct patient care. Nurses provide comprehensive care to patients, which includes administering medications, dressing wounds, monitoring their vital signs, assisting with daily activities. They are often the first healthcare professional to assess a patient's condition and implement interventions. Nurses play an important role in advocating for their patients. They represent patients' interests in care decisions, ensuring their voices are heard, especially when patients are unable to speak for themselves. Nurses are responsible for educating patients and their families about health conditions, medications, lifestyle changes. Education is crucial for empowering patients to manage their own health and make informed decisions. Nurses work collaboratively with physicians, specialists, and other healthcare providers to create and implement effective treatment plans. They often serve as the middleman between patients and doctors, ensuring that all aspects of a patient's care are coordinated and communicated. Emotional and physiological support. Nurses provide not only physical care, but also emotional support. They help patients cope with the stress of illness, surgery, or recovery. Nursing in a broad field with numerous specializations allow nurses to focus on areas that align with their interests and skills. Some notable specializations include pediatric nursing, which is when you're caring for children. Geriatric nursing is when you're caring for older adults. Emergency nursing, you work in the ER at the hospital. Critical care nursing is in the CCU or the ICU at the hospital. And then of course you have your oncology nurses, which take care of patients that have cancer. Some challenges in nursing include, while nursing is a rewarding profession, it comes with its share of a lot of challenges also. Nurses work often long hours, sometimes exceeding 12-hour shifts, which can lead to fatigue and burnout. The emotional toll of caring for seriously ill patients can be significant, requiring resilience and strong coping mechanisms. Additionally, nurses must navigate complex healthcare systems, often dealing with administrative tasks that can detract from direct patient care. The COVID-19 pandemic highlighted many of these challenges, emphasizing the need for adequate staff, mental health support, and resources for nurses. Nurses are the largest group of healthcare professionals worldwide, accounting for about 59% of the global health workforce, according to the World Health Organization. Their contributions are essential for achieving universal health coverage and improving health outcomes. Research consistently shows that higher nurse-to-patient ratios are associated with better patient outcomes, including lower rates of complications and mortality. Furthermore, nurses are crucial in public health initiatives promoting preventive care, health education, and community health programs. In conclusion, nurses are irreplaceable members of the healthcare community, providing critical care and support to patients and their families. Their dedication, expertise, and compassion make a significant difference in the lives of those that they serve. Thank you for your attention, and I hope this speech gives you a deeper understanding of what it means to be a nurse and the profound impact they have on our lives.